very frequently will get referrals which say probable hip pain, labral tear. And they'll come expecting labral treatment. But that's not what you should be doing. You need to be focusing on what might be causing pathology in the hip that may lead also to a labral tear.
Right.
And that again is these broad categories of impingement and instability, and that's what I spend most of my time trying to figure out. Firstly, is it the hip? And we'll come to that for Ace in a sec, but secondary, if it is the hip, what is the mechanism? What is the pathomechanism of that labral tear? That's what I'm really interested in, rather than the simple finding of the labral tear, if that makes sense.
Yeah.
So I would say that would be my summary of the situation. Now, on a very sort of, I'm pressing the wrong button, sorry. On a very sort of simple level, in the lateral hip, again, as we come through and we see, the insertions of the gluteal muscles here, they're not really lighting up a huge amount here either. And they're certainly not seeing any tears or detachments, which I think I probably could spot. But it doesn't feel like he's got a lot of active tendinopathy in that hip. That examination, this was only about a couple of weeks ago, wasn't it? Oh, maybe in a week and a bit, yeah. So, I mean, that's sort of my summary of what I'm seeing for Asa. So if I was going to properly offer an opinion on his hip, I'd almost refuse to do that without an X-ray, because I can't really appreciate the anatomy from this scan in a way that I can. That could partly be the way I've been taught to think about things, but I think if I saw an X-ray, what we might see is a little bit of what we call acetabular overcoverage. So we might see the S7 just creeping over the head of the femur a bit, and that can potentially lead to some impingement. That could potentially be a cause of hip pain.
Why would that have come on so recently, then, given that he's been exercising for years and years now?
I mean, that's a really good question, and I think there's an element to which also, as I said, I don't think the hip is completely normal. I don't think it's terribly bad, but it's not completely normal. So he could have this very mild thinning and very early wear, and that combination could be what's causing the pain. But sometimes I think if we focus just on the impingement, because obviously you're quite right, most people's anatomy is what it was when they were sort of 15, 16 really, in men, and even younger in women. So why it suddenly causes pain is never completely clear to me. It can be a little bit sometimes due to a change in activity, it could be a change in motion, could be a change in the muscular envelope in the hip and some abnormal motion within the joint. It's one of the reasons why therapy for impingement works, is because you can kind of realign the hip joint and the muscle control. But I think sometimes there's not a clear answer for that.